In Nigeria, about 50% of women have been victims of one form of gender violence or the other at home, in schools, workplaces and communities. Due to the patriarchal culture promoted by most tribes in the country, there is powerful social stigma around reporting violence perpetrated by men. This act of violence is rarely a one-off thing, thereby affecting the self-esteem of its victims as it lingers, or leading to death in some cases. Center for Family Health Initiative, in her programs, work together to tackle the root causes of gender inequality and work for the future of women through social and economic empowerment. We have inculcated gender norms discussions with the aim of addressing unhealthy gender norms within communities. It is expected that with constant discussion and sensitization, as well as other community interventions, inequality will be peeled away gradually to foster gender awareness and equality. Aside the socio-economic empowerment for women and girls, Cfhi also embarks on social media campaign, gender rights advocacy and capacity building to help meet the victims' challenges, hence reducing poverty, promoting sustainable development, and building good governance. Ruth Augustine is a mother of 5 who had to endure a high level of gender violence. She was abused several times by her husband, who also insists that she takes responsibility for the welfare of the family, knowing fully well that she had no means of income.
My husband lost his job after they were asked, security and drivers and cleaners were asked to leave government. And since ever then, I've been finding it difficult to cope with the family. When people bring things for us, my husband will say that we should not use it. This and this and this and this, that I'm bringing shame to them. I say, like those one bringing something to us, I've never begged them. The one I beg is those books, as I say, we should not use. There was a day somebody gave my baby, my last baby, clothes and crayfish, a bunch of crayfish. So he carried the cloth and crayfish and threw them. I was asking where all those items. He said he has thrown them away. I said, why? Why did you throw it away? He said, what can I do if you throw it away? I said, somebody who loves your family and brings some items to your family, understand, can never harm your family. So in the process of argument, he pushed me and I broke my leg. So we have been facing it like that, even fighting and quarreling because of the issue of house, because he wants to sell the house. Because he wants to sell the house and go and settle in the family, settle in the village. I say no. So when I bring the issue of no of selling of the house, it brings problem. They will start quarreling and fighting.
She had to start selling local juice, but could not afford taking her children to school with that. Ruth Augustine was introduced to Center for Family Health Initiative in 2015 by a teacher in Government Secondary School Kubwa, Abuja, where over 50 children are on Cfhi scholarship scheme.
To pay children's school fees has been a problem. And after my daughters finished, when they were about to enter junior secondary school, I called my elder sister. So she helped me and sent some money to me. Then she was working, which I used to put them in junior secondary school. After when they finished, my children were in the house. We couldn't raise money to put them in senior. So there was a woman I was working with, which told my children that if they do well, that will pay their school fees for that very particular thing. So by the grace of God, when they did well, the husband brought out 40,000 naira to the children to register them. Then when we are registering them, during the process of registration, the NGO Center for Family Health Initiative came in. So I was asked, a teacher ran to me and the other HOD told them about me and my children that there are families that they cannot pay school fees here. So they came and asked me to bring the result. So my child ran to the house and brought the result. When they brought the result, they were lucky to be among the people. They collected the result. So after collecting, they refunded some money. Since ever there, they have been the one paying for their school fees, out from SS1 to SS3. They have paid for WAEC and NECO.
She was supported with 30,000 naira to start up a retail business and given a local grinding machine to enhance the local juice business. Ruth Augustine is now a successful businesswoman and a member of CFHI's Caregiver Forum, with 2 of her children under CFHI's scholarship scheme.
Center for Family Health Initiative, they have been so good. They have been helpful to us because since they took over the twins' school fees, it's just like we removed mountain from us. And when there was a time they have a program, I was lucky to be among. They borrowed me some money, which I used to put my last baby in public school. I have paid that one. Last year they have such program too. I was part of. I was the luckiest person among those people, and I borrow money from them too, which I'm paying monthly to assist me because I want to buy grinding machine. So they helped me. So I'll be so helpful. They'll be helping us so much.